Hi, all. Welcome. We're so glad to have you joining us today. My name is Bethany Teachman, and I'm the co-director of Tide, Thriving Youth in a Digital Environment. We are thrilled to be co-hosting with Therapists in Tech. We'll just give people a minute or so to come on, and then we'll go ahead and get started. We have a fabulous speaker joining us today, and thrilled to have this opportunity to hear your questions and hear from them. So, as I said, we'll just give it a few seconds as people are logging in here, and then we'll go ahead. We especially appreciate people joining on a hot summer day. All right. Well, we know we'll keep having people jump in, but we'll go ahead and get started. So I have the pleasure, I'm a professor of psychology at the University of Virginia and the director of clinical training there. And I have the pleasure of co-directing Tide, which is Thriving Youth in a Digital Environment. And it's a new initiative at the University of Virginia that's designed to address two key questions. The first is recognizing that youth are developing in a digital context. We're really interested in understanding and advancing the science about what the impacts are, the good, the bad, and in what ways it's just really another context for development. And then secondarily, really recognizing that youth are developing in this digital context, we're interested in the question of how we can really leverage that. So, how can we help use that to increase access to care through digital mental health assessments and interventions? So, that brings us here today. And we are thrilled to be partnering with Therapists in Tech to launch this summer series. If you want to learn more about the summer series as well as the various initiatives that we run, please go to tide.virginia.edu. I want to particularly highlight some of our industry partnership opportunities, including a recently launched seed grant program that tries to encourage academic industry partnerships and provide some initial financial support to get those off the ground. So please take a look and please keep in mind we have the series is going to go on throughout the summer, so we still have a few more fabulous speakers to hear from. And before we jump in and have the pleasure of hearing from Eldin today, I'm going to welcome David Cooper, our moderator today and co-sponsor of this series. David is the executive director of Therapists in Tech, which he'll tell you a little bit about now. And I'll leave you in good hands. Thanks, David.
Thanks, Bethany. Hi, everybody. I'm David Cooper, Executive Director at the organization called Therapists in Tech, which is the largest collection of clinicians and clinically trained folks working in digital mental health. We provide education, community about entering the field, what to do once you're in the field, and just try to promote, all the things you never learned in grad school because, none of us learned any of this stuff. It's all still new to us as well. But we're excited to partner with Tide on this educational series because that's one of the things at the heart of our organization is passing that information along and helping others learn about the digital health industry. So I'm so happy to talk with you today and with one of my favorite people in the digital health industry. Eldin is the director of measurement and outcomes at Humankind. He has a PhD in preventative medicine from USC. And before transitioning into industry as a data science expert, he's had a number of academic positions. He and I work together at Teladoc, and I can tell you there's probably a few better people to talk with you about how do you transition from sort of the traditional academic space into digital health or industry, especially in data science and promoting all of those research skills, putting them to work in industry. So, Eldon, come on in the webinar and we'll get started peppering you with questions, and then open it up for folks. We'll talk until about 15 after, and then open it up for Q&A. But first, Eldon, I want to make sure I got your intro and bio right, that you're doing all those things. But curious, also what drew you to go from academia into industry? Sort of what spurred that move for you?
No, thanks, David. That was a wonderful, wonderful introduction. I couldn't have done a better one about myself. I think so. What really drew me to digital health, it's kind of almost historical in some sense. I've always been kind of tech forward, buying the new tech first, everything like that. I've been like that for my entire life, basically. And then, over time, I self-taught programming and all of that. And then I went into health psychology in my master's, and around that time, EMA started getting really, really popular, and we as we went from Palm Pilots to Android phones and EMA, it was like kind of my calling, right? Like you're combining things that you love to do with things that you're actually studying. And that kind of got me into uh, digital health, uh, which then, led me to become more and more of a methodologist throughout my PhD program, and less so focused on health psychology specifically, not in one specific domain, but across a variety of domains. So you understand, the behavioral theories and everything, but um, I would, I learned sort of a wide variety of things throughout my PhD program. Did an internship uh, at Omana Health, and then that really kind of sealed the deal in terms of me wanting to um, at least try industry at some point. I did, however, go into academia shortly after. And so I was in academia for a little while. Uh, and eventually I realized I was definitely the research assistant professor type, not the person that was wanting to write the grants and get the funding. And then that sort of uh, is how I ended up at Teladoc, kind of right after.
Yeah, so it sounds like it was sort of a combination of sort of your natural interest in technology and how do I apply this to what I'm doing academically and studying it. And again, I know when we worked together, that methodology piece was something I always relied on you because I'm like, I'm the write the grants guy. I'm not the study arm guy. I needed you for that. Just curious, like, are there elements from your academic background that you were surprised at how valuable they were in what
Um,
you've done in industry or in your current role?
Yeah, so there's really this content expertise that you get from being in academia that is not uh is not something that you can just you can't, it's hard to really just learn in a short amount of time, and it's hard to really put together. And this is something that you get from going to conferences, writing papers, doing your dissertation, and you're reading tons of articles. And you get to a level of being able to, recite people's last names as, someone asks a question of like, what is what is a emotional theory or something that would back up this thing, and you could just recite authors that you personally know, or you can pull up systematic reviews that you've cited. That was kind of surprising because people would always ask for what's some backed evidence for this intervention that we're about to implement or something that we're about to do, and you could pull something up that's better than what even AI can do. Um, and so because you're able to just do off the top of your head, you're able to pick the most relevant source. So that was actually surprising to me because again, I came in with being very methods focused, but I'm finding that I'm being able to pick up this content expertise as being my highlight. And the other thing that was really surprising is that industry is not ahead in terms of a lot of this uh, very, very advanced methodology that we are taught.
Mhm.
Things like mixed effects modeling and that kind of stuff. So a lot of the early methodology work, like very simple factor analytics, even just like, how do you explain omnibus ANOVAs to people? Things like that, like very early methodology work. Uh,
Yeah.
the fact that we were taught that so early on, it becomes kind of second nature, and you have to like kind of learn to explain that to people. But that also was surprising that that was such a relevant uh, and really commonly used thing. I thought I'd be going into a job and doing super advanced things, but really you're doing a
Right.
lot of simplistic uh, analyses, but that get the point across. I think that's kind of
So it's less about fancy methods and analyses and more about, oh, let me actually explain this in a way that, at a sixth grade level. And, well, I mean, when we worked together, I often said like, hey man, I don't need nature neuroscience level evidence here. I just need something that's good enough, right? Um, So that's, I guess, are there other, so the, it sounds like having even just like the base
Mhm.
statistical training
Mhm.
coming in, but really having that skill of explanation and translation with the data is one of the big strengths that you had coming in. Are there other
Mhm.
strengths that you felt gave you an edge maybe over some of the, I'm thinking more of like the self-taught data scientists and folks that you see in industry now?
Yeah, and in terms of that, I mean, I think going in and having an advisor that recognized that I was heavily methods oriented to begin with was really useful and really special in the way that she was able to foster and allow me to explore. So I took things like GIS courses, advanced
Mm,
work. So I learned, Python that way. And then, I did app development. So I developed an Android app. So I had, Java and things. That's not things you normally learn in a health behavior program. I worked on app development for an app called Mix Wild, which is used in a number of different studies now. It's really nice to look at the counter for people using Mix Wild for mixed effects models, to, to actually see your work having an effect. So I think that having that ability to explore and not just focus on sort of the prescribed course content for a uh, traditional program was really what I think that was a huge strength coming out, and I encourage everyone to do that.
so, right, because like there's no, like all the resources, if people, out there can teach themselves data science, there are all those things that you can teach yourself. It's how do you weave it back in and how do you, so the biggest strength is combining your academic training with some of the more self-taught
Yeah.
practical skills. Are there things you do over or advice you'd give yourself starting out that, oh, I wish I would have done this differently?
Um, yeah, so I think like there's I didn't really focus on the fiscal component of it. So I never
Okay.
everything's very like science, like what is the contribution to science? So I think I would focus on that. Really teaching myself health economics, even though it's not
Hmm.
necessarily something I learn as part of like all my courses. And then the other thing is, we were really trained as NIH workhorses, and I feel like people in a lot of PhD programs probably will be trained as that or had been trained as that. Publications and grants that publish or perish and so on. Um, which kind of complicates things in two ways, really. The first way is that your ability to communicate to non-technical folks is stunted. I had problems with that, and I had a really good colleague that had a nice like feedback my first year at Teladoc, tell me like that's something you need to work on, and I'm like, okay, that's fair. That's 100% fair. And then the other thing is you won't be doing things like power analyses, and you won't be doing, in fact, you may be in a position where you may not even have to, at Teladoc, we didn't have to do this, but I didn't even have to like write for something like a good chunk of it because you will have medical writers who get,
Hmm.
the person that writes all your results and gets your paper, and you get the paper out, but there's a medical writer that does that, or white papers that are not peer reviewed. And again, you do the analyses, but you don't write. So some of these things where you're being trained as an NIH workhorse may not necessarily, you know, may not necessarily have any utility for those reasons. Obviously, they have other reasons,
Yeah.
but it's interesting. It's an interesting.
Well, that's a good segue into talking a little bit about kind of what you do day to day. Like tell me a little bit more about, your current role and kind of what you're doing at Humankind.
Yeah, so what I currently do is I lead a team where we look at outcomes we look at both clinical and as I mentioned fiscal outcomes, and we present these both to internal teams and external stakeholders, which are really just clients. And it really is this combination of health behavior research, which is my background, and health economics, which is not my background, but I kind of picked that up
Yeah.
working at Teladoc and so on. And really what we do is for the internal teams, we take both, again, fiscal and clinical, we weigh those similarly, and we use that to improve the product. You know, are there things that are improving clinical or fiscal outcomes, and how do we change them? How do we change the way that our team is actually delivering calls, or how our kind of AI backend works? Um, and then on the client side, the client for the most part wants to know, is the program giving them their money back for the money that they're paying for it, the ROI, the return on investment. And if even if there is sort of a break even point, they might say, well, okay, well, if we're breaking even on the fiscal side, let's look at the clinical side, which we
Hmm.
recognize there may not be a fiscal advantage, but what about clinically? Is there something clinically that's advantageous? And then we're looking at how do we pair that clinical data to other pieces um, of data, so we know people who are clinically healthy are going to be showing up to work, and obviously that's going to improve work satisfaction and productivity and so on. And so there's more to adding and demonstrating value, and that's sort of what I do, kind of big picture. No.
And what does Humankind do in generally? Like, what's the company about? Tell us a little bit about it.
Yeah, no, of course. So if you're familiar with sort of the EAP programs, and then there's also these sort of intervention delivery programs. We're sort of a bridge, a little bit bridge in between. But what we basically do is we look at individuals who, through medical claims data, who we believe would benefit from a behavioral health intervention. And there's sort of this proprietary algorithm that works in the back end, analyzing that. And we reach out to those folks and basically offer support, uh, unstructured support to really help them in ways that they may not even know they need,
Yeah.
that we may not even know they need. And so we may call someone who may have had just a major surgery or something like that, that we know is linked to, if they were to have support, mental health support, they would have a better outcome. So we may catch that surgery, note that they don't have any mental health visits, something like that, and reach out to them, and then that way, uh, that individual in the future, we hope that they'll have better outcomes now that they're connected with support.
Yeah. So, and just maybe demystifying some jargon for some people. So you have these EAP, these employee assistant programs. That's all the collection of everything your job pays for, like your health insurance or counseling or all the benefits that you get paid for, right? And instead of letting them just sit there and just
Mhm.
be like, use them if you need them, you guys are actually proactively reaching out to folks and being like, hey, you
Yeah.
just had this major surgery. Like, people get depressed after surgery. How you doing? Do we need to do anything for you? Can we help you at all? And that's, I think, what a lot of companies are looking at now, is like, how do we be more proactive with this kind of stuff? And how do we use data to be more proactive? So what are you doing day to day? Like, walk me through like a typical day and
Yeah.
or a week, and kind of how you operate, man.
Um, I mean, a good chunk of it is what we're doing right now. Just me.
Meetings.
Well, no, there are a lot of internal meetings, a lot of external meetings with clients. And the most fun ones are the ones where we are discussing, actual research and actual changes that we are going to implement. And then there's, the ones where we're discussing sort of the value add of our company, which are also, interesting, but they're not as coming from academia. It's a little bit more interesting, obviously, to discuss research and initiatives than it is to discuss the value.
Yeah.
Although the value is very important. Learn that very quickly. And so other than the meetings, I work with the data engineering data teams to make sure that all the data that we have, uh, we can kind of use, and the utility of that data, and then actually taking that data, and running uh, models that we think are
Yeah.
based on whatever the company initiatives are at the time. And then also looking at sort of, well, what's out there, what's new. Right now, for instance, we have an open role for implementing LLM, and so we're starting to do that, and obviously that's the huge thing now with AI, and so we're doing that day to day. And given my current position compared to what I used to do at Teladoc, which is more of an IC. Now it's nice to have individual who I can rely on. She's a really great person who can rely on to actually run a lot of these analytics. So I think at that point, when you get to that stage, it's a little bit better too. It's
Nicer. Yeah.
and in some ways it's really nice too because I do appreciate. I always did see myself.
Hmm.
Well, in academia, I'd love to be a PI and have students, I can mentor.
Hmm.
And that was always and it's nice to know that that doesn't actually go away. It's just slightly different, you know.
So, other than maybe like it's a lot of meetings, are there other things you wish more people knew about like how the job actually works? Like I know for me, one of the things was always like the data is way messier than you think, right? Like the back end is way, you think you look at some of these companies, you think, oh, they've got them all put together, but the back end is just like spit and glue and duct tape. Is
Yeah.
there something like you wish more people knew and like give you a little bit more sympathy about your job?
Yeah. So I guess there's like two things. I guess so. One, I do wish that there's people knew that a lot of the implementation is not overly complex. So when you
Mm,
people look at DS or data science ML, it kind of feels like a very far sort of mystic
yeah.
term. But once you break it down and figure out what it is, you're like, oh, these are just logistic regressions, or these are just t-tests, and at
Yeah.
the end of the day, these companies, and often if you enter a smaller company, maybe and or a startup or anything like that, you might be the only person who knows about mixed effects models or multi-phase,
Hmm.
and uh, pe people are still on t-tests and A/B study design. So this is uh, it's things are very early on, no matter how you really slice it, and so that there is overall the complexity I think is lower than what most people should. So don't rule out jobs that you think you are not qualified for. So that's the one thing. The other thing I think kind of related to that tangentially in a way is I think the term digital health. I think I've talked to you about this before, and
Yeah.
I'm not a huge fan of it because I think it almost has some level of gatekeeping because it's like,
Yeah.
if I don't know tech or if I don't know, this whole back end of like if I can't get hired into a FANG, then I can't work for a healthcare
Right.
company because digital health, is tech. It really is more healthcare than it is tech, and I will. That is a hill I will die on. Because for me, I see it as like if you were a food scientist and you applied to McDonald's, you wouldn't say, oh, they have an app and they have all this like fancy AI that predicts like when a person will order a meal,
Yeah.
and maybe I shouldn't be applying to this. Like you're not applying to a food tech company, you're applying to a food company. The same,
Yeah.
not you're applying to healthcare. The digital health
Yeah.
is a term we apply for a very specific thing that I think it shouldn't feel as threatening. So yeah, don't let that rule out applying for a job that may seem like you're applying for a tech company, but in reality it is healthcare.
Do you have more transferable skills than you might realize? It's more about how you spin it and how do you again, maybe people are going too far over people's heads, right? Because if they're dealing with stats 101
Right.
t-tests and you're coming in at like stats 405, right? You may
Right.
have to dumb it down a little bit or understand where they're coming from.
Right.
Are there, you know, in terms of things you're hiring for, things you're seeing out there, are there specific
Mhm.
skills or tools? Like, I mean, we talked about like, I think one of the biggest ones we talked about was communication and being able to really understand what the other person needs. That kind of goes, you said the economic models, right? Like, I know again, for me,
Mhm.
nothing makes sense until I understand how the money works. And then it's like, oh, okay, now it makes sense. Are there other sort of
Mhm.
skills or specific tools? Like, should you be learning SAS versus R versus Python? Are there, practical tips like that?
Yeah, and I definitely think that so there is, there is this a lot of this sort of content expertise and communication and all this like these soft skills that I've mentioned, and these are a lot of these are transferable. Um, you really like you just mentioned R and Python, and I think learning those two to what I would consider a pretty sophisticated degree is really beneficial. Ultimately, hard skills are what will keep you at a position. And eventually, when you're in kind of a supervisory role, then you're able to kind of pass those skills down, or at least evaluate or code review individuals who might be less kind of at a lower expertise, or hire someone who has a higher expertise than you, but at least you understand their code. Um, so I do think that Python and R are definitely two of the things that I would learn regardless, and know how to switch between the two. So often we think of sort of data engineering, which is more on database side. You probably won't be probably not related to this. And then you kind of think of very ML, Python, less statistically oriented, and just more you know data manipulation and PySpark and things like that.
Hmm.
And then you have R, which sits there as a really useful tool for statistics and being able to switch between PySpark and R, and understanding that there are like tools that work in tandem with each other, and knowing how to use multiple tools, I think, is useful. Uh, Going all the way to the extent that I think if you ever look at a standard computer science data scientist resume, which has a ton of different things, I think it's a little overkill. It's sort of master of or what is it called? Jack of all trades, master of none.
Trade Master None.
Yeah,
Yeah.
I mean, really, it's like at the end of the day, those people, they're skilled in a lot of things and they can optimize and do all these things, but then there's that whole content expertise, and so it's better to be really an expert in R and Python and then have the content expertise than it is to know 50 different variations of kind of different ways to basically spin up SQL, which are
Right.
databases and things like that. Because ultimately they're all roughly the same thing. If you know R and Python, I think is a really solid foundation.
Are there specific resources or projects that you might recommend people undertake or things that can showcase their skills? I know one for me is I always recommend free code camp to people because it's free. It's an easy way to kind of get started and dip your toe into some of this stuff. Are things that come from your resource list that you'd want to share with folks?
Yeah, so it's really interesting because I've never really had sort of a gap. I've always kind of been training consecutive. So I've always used real data, and
Yeah.
I think non-conventionally, I guess, because so these are sort of what you mentioned are conventional, and I think this is what's basically if you were to maybe Google or look up Copilot or something, this maybe you could get a list of these. But I think non-conventionally, maybe even reaching out to people that from your past, academically, who don't have time, because time is money ultimately, and
Yeah.
using that data and trying to find and work on real data to solve real problems. I think that is ultimately the best way to learn, because you will hit roadblocks, you will hit uh, common things that are kind of repeated ad nauseum for the rest of your career. That uh, these are basically you'll start to get an intuition for what needs to be done and in what way. And so I think that's the best advice is like get access to real data somehow.
Yeah.
If you're really trying to train and work on it that way, in addition to
Wait, you mean every data set isn't nice and perfectly clean and organized? And they're like, you come from a company, and of course it's going to be all standardized and everything. I mean, yeah, always. But yeah, I mean, there are those plenty of those open data sets or things that you can
yeah.
work on. But
Mhm.
I think the piece of advice I always give, and I'm curious about your feeling of this, is like do like maybe you kind of hit on it a little bit, but do something practical.
Right.
Do something with like an actual result that you can showcase.
Yep.
You can not only like walk through how you did what you did, because I
Mhm.
think that will be part of any kind of interview process and what people want to know, but
Right.
then also the result, like can I understand what this result is coming from somebody who knows nothing about what you're doing?
Yeah, exactly. Yeah. And I will say also one of the things that I reminded myself to make sure I really mention it, but learn CMS, learn claims data,
Mm,
because it is helpful for everything related to data,
yeah,
digital health, and also helpful for your life, because it will save you money in real life. So learn it, I think, know how the healthcare system in the US works on the billing side.
yeah,
I think there's a lot of I mean, you'll be using that kind of data, but also I think yeah, even just in regular day-to-day life, knowing how that stuff works is helpful. It's almost like a just a general life tip.
agreed. You have any good teach yourself resources for that?
uh, Honestly, it's the CMS website, if
Okay,
anything, and really looking through just how learn about what I would do is look at the forms. So
yeah,
the forms that individuals fill out to bill for their services, and look at how those fields are done, and then look at when you go to your next doctor's visit, and just kind of again looking at the practicality,
map them.
map everything,
Yeah.
look at how these things are working, um, and I think that's really the best thing is really again I think with practicality comes the most knowledge.
Yeah. Is there any, so on the flip side of kind of what we've been talking about, are there any habits or I think you mentioned it a little bit, but like in terms of the NIH workhorse, like
Mhm.
it's not all just about publish or perish. Are there other
Mm.
habits or things you've had to unlearn, not just learn, but like, okay, I gotta stop doing this.
Yeah. No, there's definitely there's this term MVP, right? You hear it a lot, minimally viable product, and I think that really applies to data and results too. And I think unlearning the idea that there is no that you want to cover all your bases, that you want to, if someone asks you like, is this product or working, or are we getting value in this?
Yeah.
Coming back with yes, and the number is this is sufficient. And you don't have to, at some point, you can say this is good enough and not this needs to be perfect. And I think that that is, as academics, that's a really hard habit to break.
Yeah.
Want to say like this is statistically significant. This is, this is the p value, and like that we could have explored it in all these different ways.
Hmm.
In reality, sometimes you, it's just not like it's the whole 80/20, uh, the 80/20 rule with
Yeah.
effort. But in this case, it's just like sometimes you just need to. It's very binary, and you just need to complete it.
Yeah, it's just speed is almost more important than certainty in a lot of cases of just like or again depending on the use case. I know we used to talk about the data funnel, right? Like there's all the data that we have, there's the data we can use internally, the data for marketing, and then like the data that we're going to publish on. And so as you kind of move down that funnel, you can be a little bit, I wouldn't say loosey goosey, but you don't have to be quite as rigorous. You can kind of be like, I'm pretty sure this is good enough for, we'll try it and we'll see, and if it doesn't work, that's not the end of the world.
Right. Yeah. Yeah. And often when you're presenting to clients, and uh, you know, it actually works against you if you try to present too much information, because then they won't know what things are, and ask, and that leads to more questions. And sometimes it's like if you just gave one number, they it projects confidence, um,
Mhm.
and adding more, it's kind of a weird conundrum because you don't think about that academically. It's like usually you want to give out more information. It's like if you read a paper
Right.
that just had the results and not how someone got there, you'd be like, well, that's a little odd, but
That's all the time somebody might have for is just like, okay, tell me. Right. And then it comes with that level of trust. And,
right.
you become, again, I know when we worked together, that's what I relied on you for was like, I could sit there and have you explain the methods to me and we could go through it and I could understand it and appreciate it. But also it's like, that's what I hired you for. That's what we were hired for, Eldon. You do it, man. I trust you to do it. Um, and so you can skip a lot of that stuff, or at least, have it in your back pocket, but you don't necessarily have to use it all the time. You know, one more thing, and then we can get into Q&A. I know we've talked a little bit about some jargon like EAP, CMS, the Center for Medicare Services, MVP, minimum viable product, that idea of like just get something out the door. There are other acronyms, terms you think people should know going into, you're like, oh yeah, this is a total one that nobody knows, or it's inside baseball kind of thing.
Uh, really for these kind of the positions that I've been in, because you're delivering a lot of information to external um, vendors, essentially, there's a lot of health economics. So making sure
Yeah.
DID, difference in differences, which really is just interactions, uh,
Hmm.
and knowing things like that back end, like PSM, propensity score matching. And I think in addition to industry terminology, also being aware that there is a um, kind of a terminology synonym between data science and statistics, and you might
Mm,
be trained in statistics, and you might be entering a data science team, and you might be asked a question about, like the difference between like, or like something about variance, and you might be thinking of statistical variance where they're actually looking at something like internal external reliability or validity rather. So, or internal external reliability. Yeah. So there's terms that are in statistics and data science that are somewhat related to each other, or they're synonyms of each other. And I think no
yeah.
terms are, and you could, use Copilot or something to look that stuff up. But there's a lot of them. Knowing that before you go into any sort of data science interview, um, and I think I remember just my first interview ever just butchering that because I'm like, they asked me some question. I'm like, I literally have never heard of this term. And then the next I looked it up after. I'm like, okay, well, if they had just phrased it differently,
Yeah.
and we
And
made
I
it
think,
different.
yeah, and I think all of us, like when we first get on the job, we all have a look it up file, right? Like
Right.
you write down, you hear something in a meeting, you're like, I'm just going to put that in my look it up file and look it up after the meeting. And you smile and nod, and then you go frantically
Yeah.
Google it after the meeting. Well, I think now we can get into some of the Q&A. So again, if any of you watching have questions, please drop them in the Q&A. So curious, Eldon, from one of the people wanted to know, do you or members of your team involve patients or end users in the work that you're doing? Or is it just solely sort of quantitative?
Sorry, what do you mean by do we involve patient or do we actually like reach out to them?
Yeah, like are you doing any kind of like
Yeah.
qualitative human-centered design kind of stuff?
Yeah. So I actually have not done any human-centered design directly. However, when we do uh, when we go into sort of uh, future work, I'm sure
Mhm.
that will be something. Considering these are individuals that we reach out to, uh, we have sort of two sets of users. So we have both the people being called and then our people that are working
Mhm.
in call centers. Um, so we do work with those individuals. So the people that are actually sending out the calls and making the calls to develop because they work on a back end, right, where they have to take notes. So there are human-centered components to that we have to work on. But it less so at the moment. Just
Yeah.
I think it's just mainly because of priorities. But yeah,
Which are always
yeah,
shifting and changing, especially if you're at like a startup kind of space. And I think, at least my experience, and I don't know how you think about this, but it seems like a lot of times there is definitely a split in terms of the roles of there are on the data science. It's much more quantitative, and then the user-centered design stuff tends to happen in UX teams and like the usability team. So they kind of split their, responsibilities for
Right.
those kind of things. Okay, this is right up your alley. For clinicians trying to measure their outcomes in terms of how those outcomes would have a strong signal, like how would you push them to sort of measure outcomes in terms that are sort of real for the industry, or be most useful, and or if you were looking to maybe track effectiveness in terms of how we talk and think about effectiveness in industry, how would you look at that?
Right. So again, I think really trying to map. So if you're trying to map industry effectiveness, there is, again, I keep mentioning this fiscal and clinical piece, and we've also sort of talked about this, David, about this sort of like not in this call, but previously, the sort of like goose, like golden goose of like if you could connect the dollar value to a
Hmm.
9, that would be like the gold thing, gold standard. And really that is what we're that's what I would focus on sort of is if you can have some sort of measure of clinical improvement and then using a literature-based uh, approach to say, as a clinician, my individuals are improving in this measure in this way, and this measure is associated with fiscal improvements based on all these different sources, uh, that people take that as a legitimate estimate, because they
Yeah.
you as a clinician to be able to go through and do all these ROI things that we have teams that do. So I think as an individual clinician, that is something you can do. Um, and
And
yeah,
I think you're absolutely right. Those two pillars are
yeah,
critically important, and kind of goes back to one of those things of learning from academia as you translate into industry. It's not just about is this clinically effective or, significant. Can we also afford to do it, right? Like, is this a real world intervention that will have a business model that can support it, or um, has an effect that somebody is willing to pay for, right? Like there's tons of, I can, without naming names, I can think of specific companies that found things that were statistically significant but weren't commercially significant,
right.
right? So nobody was like, great, cool, that's awesome. I'm not going to pay for it, and they went out of business, right? And I think that balancing of those two real world pillars are really important as you translate into the private sector from academia. Um, Any suggestions for international students in terms of jobs? Um, Things that you've seen or best practices that you've run across or anything like that?
Yeah. So with that, I think the I don't typically, so I'm not 100% familiar with a lot of the sort of the F1 and the OTP process. I know that is a complicated process, um, and a lot of smaller companies may not have access to get
Hmm.
those or the sponsor. I know, going in as an OTP, you may have only a small running uh, clock essentially, and some companies may not want to hire that because they're like
Yeah.
years because they can't support like an H-1B, for instance, after that. And so I guess so I putting those complexities aside, what I will say is tailoring your resume and making it I think unique, and making your like social media profile, and the social media being LinkedIn, and your outreach profile different is really the key. I think the biggest sort of distinction that I see is when we see a lot of like CS applicants who in our case we want someone with uh, content expertise. So if you're just
Mm.
CS and you have no content expertise or no background in health, then we basically dismiss the application. And we get a lot of these applications where it is sort of a CS background, but the resumes are very, what I would say is very blueprint. And so um, differentiating that in however
Yeah.
ways you can to make it not look like a traditional resume, and also I think having a LinkedIn profile that sort of shows that you are not you are something that is worth more to a company. And again,
Hmm.
in some cases there are just cases where smaller companies may just not have the ability to hire someone beyond something like a 2 year OTP, and they don't necessarily want that.
Yeah, I think that is sort of a sad truism that it is a bit more mercenary and or at least more, focused on how can I benefit from this? Whether that's who they hire or again, whether, international or kind of like you said, when I talk to people, I'm like, yeah, the thing I really want to know is can you do the job? And the more you can demonstrate that to me, I might not be very good about translating what the job I want done is, but you can be really good about saying, hey, here are my strengths. Here are the things I've done in the past to showcase. Then I can go, oh, yes, that's what I need. I need someone who can do that thing. And you said, I've done the thing. And great. That makes it much easier for me to pick you out and say, yes, I want you. And I think another thing you really hit on is if I'm recommending, especially for international folks, to target companies, probably some of the larger multinational organizations are probably good um, to look at, or local startups, right? Within, if there's any kind of health startups in your specific country or area, those are probably going to be easier. Or also, I think there are now companies that do sort of more international consulting pools. I know we think about them in terms of development. Um, we're hiring software developers. Like we'll have, we outsource that to overseas a lot of times. I think same thing can be done with data science. So looking for those kind of opportunities might be a good one to get into. Um, Sort of combining a few questions here. What advice would you have for someone who's maybe starting their internship year, joining the workforce in the next year, given the current public health landscape, research landscape, industry landscape, kind of what advice, what skill sets or anything like that would you recommend for people to really double down on over the next year?
Yeah, so two things I think I would really focus on. One, and I'll go back to this, don't rule jobs out. Um, just because you don't have the skill set for it. So there's the whole like you should only really be qualified for some percentage. I don't remember if it's 80 or 60%, some number percentage of a job if you're applying for it. And really be okay with applying for jobs where you think you're really only you may not, we have as again as academics, we aim for this like strive for perfection, strive for meeting this exact like if you were going to originally apply for this NIH program officer, you were going to be a program officer who studied like cancer and physical activity,
Hmm.
and like that's what they were looking for. Uh, it's just not that specific. Like, be okay to apply the positions. Um, and then related to that, uh, apply for positions. So while you're learning, as I mentioned, Python, R, a lot of these hard skills, uh, actually use multiple resources, whether it's your network, so not just LinkedIn, not everything's posted on LinkedIn. Use your network to apply for jobs, and don't be dissuaded by the fact that there are uh, tons of applicants. So I have people I know who work in TA, and a lot of these applications are essentially flooded by companies that will flood portals with tons of applicants, and you might see something like a really nice, relevant data science position, and you might say, oh, well, I only know like some piece of that, and there's so many hundreds of people applying. There's no way I can get that job. Apply. And better yet, I think in addition to, again, while you're learning these hard skills, grow your network. And if you truly care about applying to a company, don't apply to it without an internal referral. I
Mm-hmm.
that's another there's just I mean it's such a big difference that if you know someone internally uh, to a point where you don't even really have to know them that well,
Right.
having that internal referral, then they usually get some sort of bonus. They'll get something out of it.
Yeah.
Quite the incentive for them. So they could be your friend for a little bit. Um, it serves everyone. But yeah, I think that's one of the things as academics is we try to aim for perfection. And you know, currently the public health landscape is not, you know, there's a lot of individuals out there looking for positions. And I think, uh, but surprisingly, again, given that we're hiring, and I did not expect to see so few. So
Mm.
it means that either our job posting is not reaching out to people, or people are just not applying for reasons like I said. There's just don't rule yourself out. You are capable, given how far you've already gone.
Yeah.
What a PhD program entails is pretty consequential. It's a major milestone.
Absolutely. And I would absolutely double down on that and saying the best piece of advice I could have for someone who is entering their internship year or, you know, getting to that point where next year they're going to be in the workforce is whether it's you want to go into industry or you want to go the more traditional academic clinical practice route is to really start building up that network of folks. Just about every good job I've gotten is because I knew somebody who, I mean, that's how I got my start in digital health was because I knew a professor who knew somebody and could recommend me for a position. So things like LinkedIn, communities like therapists in tech, like that's the one of the point of the community is to really be able to help make some of those connections for folks. Research companies on LinkedIn and reach out to people on via LinkedIn. I know I don't want to necessarily flood my LinkedIn inbox, but I try to respond to everybody that I can. I try to make time for that, and I think a lot of other people do too. So don't be afraid to be a little persistent or, make it stand out like, "Oh, I saw your talk on X or that you guys are working on Y. That's really interesting. I want to learn more about it." I think most people will be willing to give you a short, 30-minute informational interview. Ask them who else you could talk to. Because then when it comes time for industry, you can come back around and be like, hey, we talked 6 months ago. Oh, yeah, I totally remember that person. Yeah, here you go. Give me your resume. I'll put it in the system. Or we're not hiring, but I know somebody who is. And being able to do that, that's, I think, the most helpful thing that you can do beyond like practicing any skill sets or anything like that. Um, okay, we're coming up on time. Thank you, Eldin. Any last words? Any last things you want to, we didn't talk about anything?
No, I think really just do your best again, and don't don't go to work on developing the skills, and also I think don't underplay the sheer like level of luck in some cases. Sometimes
100%.
luck is really there is a difference between when I'm looking through a roster or something and me clicking one person's name versus the other, and that really could be it. Uh, I got my first job out of my PhD program because I had my CV open at Starbucks, and my boss looked down and saw my CV. And so it really, it's just luck at some point, and don't
Yeah.
downplay that. So if you are going through these things, like, keep, keep at it.
Stiff upper lip. I mean, it doesn't, yeah, it's not, there's nothing you could really do about luck except, well, I like to, I learned a concept from someone called it, expanding your luck area surface. So, you can't necessarily be more lucky, but you can give yourself more chances to be lucky. And that's where networking comes into play. That's where being prepared to have that conversation at Starbucks and be like, what are you working on? Oh, I'm working on this. What do you do? Oh, I know that company. You guys are working on X, Y, and Z. And I think those are the things that give you the opportunities to capitalize on that luck when it does happen.
Yeah.
Eldin, thank you so much for being here with me today. Thank you so much to Tide for hosting this series. I know it's so important for everyone in grad school right now or folks just interested in the area. I'm so happy we could have this summer series to help folks learn. And thank you again, Eldon. Thank you for your time.
Thank you.
Thanks, everybody.